Thank you. Dr. Hahn, as you heard, I am very concerned about the delays in testing. I have people in my state who may have been exposed. They cannot get answers about where to go, and health officials are telling us that they fear that this virus has been circulating for weeks undetected. We were relieved a month ago when CDC began to ship diagnostic tests to our state and local labs, but within days, many labs reported validation issues with those tests, leading to inconclusive results, and CDC and FDA began to work on remedying that. But it wasn't until February 27th that CDC began distributing new test kits, and at the same time, academic medical centers across the country were raising concerns about the lack of availability of diagnostic testing and burdensome requirements FDA was imposing. For example, FDA asked labs to submit information about 100 tests at a time when only 15 people in the U.S. were known to be infected. Now, FDA has worked to address these issues with the guidance on lab testing that it issued this past weekend, but press reports now indicate the publication of this guidance was delayed within HHS. I was glad to read last night that you now believe you're going to be able to do 1 million tests by the end of the week, but frankly, I'm hearing from professionals that that is unrealistic. So I wanted to ask you, first of all, what happened at the department that created these delays, and how can you clarify that that estimate of 1 million tests is accurate?
Thank you, Senator. So first of all, with respect to the timeline of the development of the tests, CDC obtains the sequence of the virus. That's where it starts, and they're able to develop a test based upon the identification of that sequence. They moved rapidly to develop this PCR-based test, as was just described. We received the validation information around that test on February 3rd, and on February 4th, we issued the emergency use authorization to allow that test to be used. During the scale-up process, which occurred in the week or so afterward and sending it out to the public health labs, as you mentioned, it was identified at some of the public health labs, not all of them, that they weren't able to reproduce and validate the test. CDC heard that information, came to FDA, and we worked to correct that issue. At the same time, simultaneously, we were working with the private sector to actually scale up the use of the CDC-based test, and that's where we came into the most recent estimate regarding how we can scale up and manufacture.
I understand that. Was the publication delayed, guidance delayed within HHS? Was it yes or no?
No, it was not.
It was not delayed?
No.
And do you really believe that 1 million tests will be available by the end of this week?
Senator, let me just explain that one. So the companies that we're working with on this, they have the capacity to develop enough test kits to send out by the end of the week, and this is a dynamic process. Every day we're hearing from additional manufacturers that they can do this. 2,500 test kits by the end of the week. That should give us the capacity in the hands of laboratories, once they validate, to perform up to 1 million tests.
2,500 kits?
Kits and 500 tests per kit.
Well, I heard Dr. Kadlec say that the point of where someone goes in to get a test and a rapid, we are months away from that, correct, Dr. Kadlec?
Yes, ma'am.
Well, I'm hearing from a lot of people in my state that are really concerned about what they should do if they are infected or if they know they were within range of someone with coronavirus. Right now, the CDC's website says if you suspect you are infected, you should, quote, stay home except to get medical care. Well, right now, we know that 27% of private sector workforce in the U.S. do not have the ability to stay home from work without losing pay or if they have a loved one who's sick. In fact, the U.S. is one of only 2 OECD countries that doesn't provide paid leave for personnel illness. If we're telling people to stay home, just think about the facility that's been impacted. It's a senior center, low-income workers there. All of them are being told to stay home for 2 weeks. Dr. Schuchat, I just have to ask you, would it be beneficial for a public health reason right now while we combat this to have policies in place that make it possible for people to stay home from work without losing a paycheck?
Yes, absolutely.
Okay, well, I think that's something we do need to consider with this. Dr. Schuchat, I want to ask you also, I am very concerned by news reports about HHS staff who are deployed to assist with potentially infected passengers returning from abroad. And despite face-to-face contact with passengers, the staff were reportedly not appropriately trained to handle this type of public health emergency or in how to wear protective equipment. They were not quarantined, monitored, or tested for the virus, and some have since taken commercial flights and returned to work. It is not clear to me that HHS took necessary steps to protect staff and the public to either during this time or after concerns were raised with senior leadership about what happened. I'll ask both Dr. Kadlec and Dr. Schuchat, is the situation I've just described consistent with protocol, and what should have been done once the senior leadership were aware that frontline staff may have been exposed?
I can speak for CDC that we take the health of our workforce very seriously, the health and safety, and have pre-deployment, deployment, and post-deployment guidance. This is a totally new virus, and so we're learning as we go. But when we identify problems, we want to resolve them absolutely quickly.
Was what I just described to you consistent with the protocols?
I don't have the full information of that, but I believe Dr. Kadlec can probably say more.
Dr. Kadlec?
Ma'am, I'll just say we were looking into that very closely because this is not, again, to echo what Dr. Schuchat has said, we take the protection of our healthcare workers in HHS very seriously. And during that operation in particular, we are evaluating what may have been a breach, and we owe it to you as well as been identified by the whistleblower report to report back to you on that.
And Mr. Chairman, I would just say that we need people to speak up when they see this situation. It is unacceptable if any of these workers on the front lines are intimidated into staying silent or believe that they're going to be retaliated against these issues. We have to keep the protection of public foremost in our minds, and I want this looked at, and I want to make sure anybody who speaks up is protected.